Sasha Osipenko, Rachel Swain, and Savannah Montague. As an introduction, a middle ear infection is also called otitis media. It is when there is fluid buildup in the ears. It can cause muffled hearing, and it's one of the most common causes of healthcare visits among children in the United States. Over 70% of children have experienced a middle ear infection by the time they are 2 years old. They're most common in the fall and winter seasons, and they're also heavily correlated with upper respiratory infections. Here is a chart of the prevalence of AOM in Utah. The first line represents children ages 0 to 4, and the second line represents children ages 5 to 17 years old. For the prevalence in the United States, there was a study done where 5.8 million patients were at risk each year, and there were on average 1.21 million episodes annually among insured children, and the study was done between 1998 and 2018. Then for international prevalence, this was more of an estimate because they don't have all the data, but in 2005 they did an estimate of the burden of disease caused by otitis media, and so approximately 709 million cases each year were found as an estimate. Going on to nursing assessment, nurses help diagnose ear infections based on the symptoms patients are experiencing. They perform a physical assessment so they can see when patients have symptoms of headache, fever, irritability, pulling at the ear, discharge from the ear, or other symptoms of upper respiratory infection. Some triggers, obviously stated before, respiratory infections. The severity can spread, but it is rare. And a big part of ear infections is an impact on daily life of the child or patient. It can cause a lot of pain, just a lot of problems with hearing, risk for other injury or infection. And one of the main tools used to assess is an otoscope. And this assessment involves an interdisciplinary team. Sometimes physicians will perform this assessment. It just depends on where you are working.
All right, for the nursing management, first of all, it's the assessment, and that is the observing of the signs and symptoms of otitis media, and that includes moderate to severe bulging of the tympanic membrane, as well as a new onset of otorrhea with pain. The planning is based off of the physician's diagnosis and prescriptions, and so the nurse mainly has to understand what their plan is for whether they're going to do analgesics to help with the pain, and then whether or not they're going to do antibiotic therapy or observation therapy. And if they do the observation therapy, to make sure that it's communicated to the patient that if signs or symptoms get worse, that they are supposed to come back and have an appointment to make sure that that is addressed. And the implementation is mainly for the nurse to give those specific treatments, especially if they are ordered for a topical antibiotic or if it's bad enough, a tympanostomy tube, as well as the care plan explanation. And then evaluation. If symptoms continue 48 to 72 hours after the start of antibiotic treatment, the patient has to be reevaluated because that means that the treatment needs to be changed to be able to take care of it. And then coordination. Nurse has to coordinate a lot with the physician as they are the ones doing the diagnosis and treatment of this disease, as well as the prescriptions. And then advocacy. With the fear of antibiotic-resistant bacteria, nurses advocate for the individualized care. So whether they are truly in need of antibiotics or if they should truly not have the antibiotics with that fear of that bacteria, it's the nurse's job to do what is best in the favor of the patient. And then documentation. Signs and symptoms have to be documented, as well as treatment and any changes in status. And then safety, as this condition is at risk for persistent, recurrent, and chronic conditions, there's just a lot more awareness of the persistent conditions and what that looks like, and just making sure that the patient is truly safe before they are discharged or sent home with those specific antibiotics or with that specific care plan.
For patient education, most of the time we are going to be educating the parents more than the patient because ear infections are mostly an issue for infants and young children. So it is really important that we explain to parents what is going on, how it's an infection behind the eardrum that they can't really see. We can also explain to them how the reason why their children are getting ear infections is because the eustachian tube is shaped differently, and it allows fluid to build up and sometimes get caught in the ear, which causes a great environment for bacterial growth. Since most infections are treated with antibiotics, it's really important that we explain that they need to finish the entire antibiotic series or else the infection can come back. And then we should explain the triggers and prevention of ear infections as well, so that they can avoid as many of the triggers as possible. And then it's also important that we explain that that if ear infections are left untreated, that damage to their hearing ability can occur. Lastly, it's really important that we remind them that children under 6 months cannot have any ibuprofen, that they can only be treated with Tylenol. And then since children can't tell us that their ears hurt, it is important that parents be on the lookout for the other symptoms. And then we can explain if children are struggling with chronic ear infections, that there are some other options like ear tubes that can make it easier for fluid to drain from the ear and prevent chronic ear infections. And so, in conclusion, otitis media is an infection of the middle ear, and it is very, very common in children. And since children, especially infants, can't necessarily say, my ear hurts, we need to be on the lookout for other symptoms like tugging at their ears, fever, just unusual fussiness. And then it is really important that when we do see those symptoms, or when children do start complaining of pain in their ears, it's really important that ear infections become treated so that hearing ability and also the quality of life can be maintained. And then lastly, teamwork between the patients, parents, the primary care provider, and the ENT provider, if that is necessary, are really essential to make sure that that this issue is treated well.